welcome to My Health Record for Specialists and your medical legal questions answered. My name's Sharon Pepper and I'm the Senior Project Officer for Primary Care Engagement, including digital health at the Gold Coast Primary Health Network. And before we get started, the Gold Coast Primary Health Network would like to acknowledge and pay respect to the land and traditional practices of the families of the Yugambeh language region of Southeast Queensland and their elders past, present and emerging. Just a little bit of housekeeping before we start. We just ask that unless you're a presenter to keep your cameras off and microphones muted. We may be able to change that at the end in the question time. And a reminder that this webinar will be recorded and made available to view on our website in the next few days. If anyone would like to ask any questions, you can type them in the chat feature. You can just choose the to everyone option. And we do have a pre-submitted question that we'll also address at the end of the presentations. So we've got some great speakers along tonight. We've got Jenny Snegovaya Jenny's the Acting Manager of Education at the Australian Digital Health Agency. We also have Georgie Haysom along tonight. So Georgie is the General Manager, Research, Education and Advocacy at medical indemnity provider Avant. Georgie is a lawyer and has worked in health law for nearly 30 years, assisting, advising and educating doctors on a wide range of medico-legal issues, including several years representing doctors in medical negligence litigation. So it's great to have Georgie along tonight because we did have a few specialists with some questions around that medico-legal issues. We're also lucky enough to have Dr. Troy Kay along tonight. Troy is a nephrologist from John Flynn Renal and is a keen user of My Health Record. So I'll be able to share how he builds it into his work processes. So I guess without any further ado, I will stop sharing and hand you over to Jenny from the Digital Health Agency.
Thank you, Sharon, for the introduction. And on behalf of the agency, I would also like to acknowledge the traditional owners of country throughout Australia and their continuing connection to land, sea and community. I would like to pay my respects to them and their cultures and to elders both past, present and emerging. So today we're going to be talking about My Health Record and how it's used in specialist practices, and most of you that are dialing in probably already have some background with My Health Record, but just to kind of set the scene for today's evening, what My Health Record is an online summary of an individual's key health information. It is an online sort of resource where a summary of the individual's key health information can be stored so that it can then be accessed by the clinicians that look after the patient and also by the patient themselves if they would like to have access to their health information. My Health Record is something that is personally controlled. So an individual controls access to their My Health Record. They can control what information is uploaded into their record, who gets to see it, you know, they can also control what sort of information in their My Health Record can be accessed as well. And it is part of a national system. So it's actually something that is available all across Australia. Practitioners from any state or territory that are looking after a patient can access this resource and find out information about the patient that they're looking after. It is something that is accessible at all times, which comes in very handy in kind of emergency situations when it might be challenging for you to find the right information about a patient, say after hours or on a public holiday or a weekend when you may not be able to contact the patient's regular healthcare provider or their regular pharmacy, for example, to get, a list of their medicines. It's a great resource to have a look at, because it is something that you can easily access at all times. But it is also something that is highly protected. We have a lot of supporting legislation that supports the use of My Health Records, such as the My Health Records Act, a lot of other sort of local privacy rules in Australia as well, to ensure that all of this highly confidential patient health information is kept secure, but so that at the same time clinicians can access this really valuable information when they do need it, especially if they can't access it through kind of any other means in some situations. So at the moment, there are more than 23.4 million My Health Records out there. So I'm very used to saying that approximately 9 in 10 of Australians have a My Health Record, which is, majority of the people that come through your clinics or practices would have a My Health Record. Most of us on the line would have one. And a lot of the records have information in them. So there is already sort of statistics that we have where we know that there's clinical information, there's documents in these individuals' My Health Records. And in the system overall, there are hundreds of millions of documents of different types that are accessible to clinicians. There's clinical documents, there is documents that relate more to medicine information. It might be prescription records or dispense records for a patient, or summaries that contain sort of a list of the patient's medications. We also have a number of different document types that consumers can upload or contribute information to, and there's already a large amount of these documents available in the system as well, which means there's a lot of information in there for you to look at when, potentially a new patient comes in that you need to have a consultation with, and you can get possibly a bit more information about them that hasn't been sent through you by the person that referred them. And we also know that there's a wide range of different practitioners that are accessing and using the system. At the moment, a very large number of pharmacies and GPs are registered with My Health Record. They're connected and they're able to upload information almost by default. In a lot of these organizations, pharmacies, even GP practices, some documents and some information is uploaded by default, especially if it is medicine type of information, such as the prescription records or dispense records. But obviously a lot of other different types of documents can be uploaded by them as well. And it is also great to see that a very high proportion of those practitioners have accessed the system. They're using it. They are also viewing information that's been uploaded by different healthcare providers, and they're using that information when they are providing their services. Public hospitals also, we have most of them across Australia connected, registered, and they're uploading different types of documents as well. Most commonly known one is probably the discharge summary, and we are working with private hospitals at the moment as well to get more private hospitals connected and information from those organizations uploaded to My Health Record also, as well as obviously we are working with specialists and specialist practices as well, just to make sure that you have the software available to you to also make it really easy for you to access My Health Record and easy for you to upload information if you would like to do so as well. So we have seen definitely an increase in the number of specialists that are getting registered and connecting with My Health Record in the past year, after there's been some work done with the software kind of industry to make sure that there is the right software available to make it easy to access the system. You probably know about the different types of documents that you can view or access in My Health Record, and I've mentioned a couple of them already, but just to kind of point out again that My Health Record system doesn't just contain documents that have been uploaded by healthcare providers. It can include documents by other types of organizations, diagnostic imaging providers, pathology, laboratories can upload their test results to My Health Record. There are also other sources, I guess, that contribute information to My Health Record. One of those examples is Medicare. So they are able to upload things like MBS items information or PBS records, immunization register information is also supplied by Medicare, and that type of information, again, almost by default is shared with a patient's My Health Record. And then there is also some consumer documents. So patients themselves can add some information about, you know, their emergency contacts, even just health notes and health summaries. If their provider is not able to upload a summary, for example, of what medications they might be on, they can add that information themselves, or a list of their allergies, for example. And as a practitioner, if you're looking at someone's My Health Record, you can always very clearly see where the information is coming from or who has uploaded it. So you'll be able to tell if it's information that a patient's added or that one of their other clinicians, you know, uploaded that piece of information. So good to remember that there's a wide range of different documents that can be uploaded. And as you get sort of familiar with using the system, you will identify what types of documents are useful to you in your particular area, your specialty, for example, or you'll know exactly what you're looking for. If you're missing, you know, a pathology test result or something like that for a patient, you'll know where to find it. To assist you with finding that information, depending on the software platform that you're using, there's also a number of different views you can look at, which kind of pull information into one kind of screen, so that, for example, if you're looking for medicines information, you can go to something called a medicines view and just see a summary of recent sort of medicine activity, new scripts prescribed or something that was dispensed. You can see it all in one screen without having to kind of sort through a lot of different documents. So there are certain sort of functions in place, depending on the software that you are using, that can help with making it a bit easier for you to find the right information. But just to point out some particular My Health Record functions, I guess, where that you can, you know, use, or reports of use that you can focus on when you're completing certain tasks. When you are prescribing new medicines or you're doing some kind of medication reconciliation, you want to find out what is the patient's, you know, list of medicines, or what are they having dispensed, how frequently are they getting certain medicines dispensed. You can get that information from the medicines view that I mentioned. If you haven't had a very comprehensive referral sent through to you and you're trying to find out a bit more information about the patient's medical history, there's a range of different summaries that you can access very quickly. Shared health summaries, which are commonly uploaded by the patient's regular GP, discharge summaries from a hospital. These types of documents are something you can access in the system online quite easily without having to call anyone or try and sort of chase up that kind of information. It helps you avoid requests for duplicate testing or scans if a patient's already had something done recently, and you can look at that result, and if it's appropriate, you might be able to avoid sending them off for duplicate testing. So you can access things like pathology or diagnostic imaging reports or views through your software to potentially get access to some of those results. Again, if they haven't been sent through to you, or if it might be a bit harder for you to track them down by other means. So you could consider using something like My Health Record to quickly check if they're in there. It can also help inform end-of-life care decisions because patients are able to upload documents like advanced care planning documents to their My Health Record with their end-of-life kind of wishes. But hopefully that gives you a bit of a summary, I guess, of some functions and some documents you can start to think about accessing and looking in your practice, just to lessen your kind of administrative burden when it comes to having to find and look for all of that patient information, or even just save you time and money, really, if you don't have to then send letters or other information, your notes, to other healthcare providers that might request that information from you as well. So it is a really great tool to try and incorporate into your kind of workflow where you can. We do quite often get asked the question, though, about whether you have permission to look at someone's My Health Record, or if you need to ask your patients if it's okay to look at their record. And actually, under the My Health Records Act, healthcare providers that are delivering healthcare to an individual patient are already authorized to view My Health Record and upload information to their patients' My Health Record. So if you work in an organization that's connected, registered with My Health Record, they've given you authority and permission to use the system as a healthcare provider, and you're providing some kind of healthcare services there, then you already have authority to look at your patient's My Health Record, to find some information about them, and you have authority to upload a document to their record as well. So that might be something like a specialist letter after your consult. You can upload that, and you don't have to necessarily ask the patient for permission. And that's pretty good to know if that is sort of an area where you thought maybe you had some concern about having to ask the patient. You are actually authorized under legislation to view or upload. There are also a number of different controls that patients have, and they can implement in their own My Health Record if they would like to have some additional controls over what type of information is accessible. So there's a number of different codes they can apply, a limited document access code or a record access code, depending on if there's certain documents that they wish to restrict access to, or their whole record. So if that happens, you will generally get a pop-up message kind of in your software asking you to enter a code, and it would be up to the patient to give you that code if they're comfortable with you accessing their My Health Record. Otherwise, in that particular situation, if there is a record access code and the patient doesn't want to provide it, then it won't be something that you can access. Although in emergency situations, if there is certain kind of criteria met, there is an emergency break glass functionality which would allow temporary access to someone's My Health Record in those very sort of specific scenarios. And if you want more information about that, we can have a chat about that later in the session. There's also a number of notifications that patients can set, so they can be notified through SMS or an email alert if a new provider has accessed their My Health Record, or if there's been new documents that have been added. So that's something that they can add to their record as well. And at all times, all access to My Health Record is monitored, it's logged. So your software will log which patients' My Health Records have been accessed, and patients can see who has accessed their record as well. So there's a lot of ways, lots of functionality, I guess, that's been put in place to protect patients' privacy and giving them control of their own kind of health information. So if you do have any other questions after our session today, there are a number of different education resources that you can access through the Australian Digital Health Agency. There's e-learning modules or webinars that we run. So please have a look at our page, which is digitalhealth.gov.au, if you would like a bit more training in My Health Record, or if you do have any other questions. So on that note, before I hand over to Georgie, I wanted to invite Dr. Kay to speak if you can, and maybe you can let us know a little bit about your kind of background and your experience with My Health Record and how you've been using it.
Sure, Jenny, and thanks for a great overview of pretty much everything it can do. Look, I think most doctors out there have faced new patients with not much information, a paucity of background clinical information with the either referral or what they've brought in with them. Sometimes they forget the referral too. And My Health Record I've found very useful to dig through the background of patients. I've certainly had a number of instances where patients can't remember details more than 2 or 3 years back, and being able to search back, even the Medicare, the MBS items have been useful for that, where I've gone back 5 years, found that they were seeing a urologist and a radiation oncologist on multiple visits over a 6-month period, and the patient had forgotten he had prostate cancer. And this is after I'd asked him if he had any prostate issues, any risk of obstruction, and indeed the answer was no, never had any problems that way. And then when I pointed that out to him, it was like, oh yeah, that's right, I did have prostate cancer. So it's incorporating it into everyday life, where what normally would happen is when you're starting to try to find out, say, they've been off to see Dr. Joe Bloggs and a new medication was added. I can't remember what the medication was. I can't remember what it does, but I've been faithfully taking it, doctor. I can quickly look on My Health Record and see what the pharmacy's been dispensing, and that will answer the question usually very quickly. And that's a lot quicker than having to call up the other practice, try to get hold of the doctor or get hold of someone who'll look at the notes and find out what that medicine was. So it's really providing a lot of shortcuts where it's my first stop. Really a lot of the time now to sort of try to find results. Doctors take my forms, sometimes modify them, forget to put me on as a copy doctor, or the pathology forgets to send it through. The patient often has 5 or 6 different pathology providers that they go through these days. So trying to log into each of them in turn is a horrible task. Again, through either the Medicare billing or sometimes with the pathology uploading, I've got an idea of the result of that a lot quicker. And the other advantage is the public hospital. So both from working in the public hospital and also seeing patients that come out of the public hospital, it's been like getting blood out of stone sometimes to get information from them. You've got to get a signed release from the patient before the medical health information services at the hospitals will release any documents. These days, most of the time I can get the discharge summary straight from My Health Record on the bulk of the patients that have said yes to it. And that is the majority of the patients these days. And working in the public hospital in reverse, we're finding it very useful with, literally it's patients all over the country. We had a patient in from Melbourne who had a background of bad kidney disease. She couldn't even remember what specialist she was seeing down there. And again, through My Health Record, we could work that out, approach the right specialist to get some of the background, but we were also able to access her previous pathology to get a feel for what her kidney function was now compared to her Melbourne figures. All of that used to take a lot longer. So it is really saving us a lot of time, and it's a very useful resource that I'm finding I'm using more and more as time goes on. And I'm convincing a lot of the patients to switch who are a no to My Health Record, usually for identity fraud concerns. When the media was beating that up some years ago, I think they're seeing now that that's a concern in every walk of life, and My Health Record's probably the least of their worries. So most of them are prepared to switch it and make life a lot easier for us sharing the information.
Thank you for that. All right. Well, we might hand over to Georgie for the time being, and maybe you can take us through some of those frequently asked medical legal questions. And then we will come back to Dr. Kay at the end. And if there's any other questions from the audience, we'll try our best to respond. Thank you, Georgie.
Great. Thanks, Jenny. Thanks, Sharon. And thanks, Troy. And thank you very much for having me this evening. I would also like to acknowledge the traditional custodians of the lands on which we are all meeting tonight. I'm coming to you from the lands of the Darug people from Northern Sydney. So I pay my respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander people here with us this evening. I need to start firstly by a bit of a disclaimer / disclosure. I am a member of the Digital Health Agency's Privacy and Security Access Committee, but I'm obviously speaking this evening wearing my Avant hat today. So let's start. What I thought we would do is just run through some of the issues that we've received questions about from our members over the last several years. I think actually, to be frank, we haven't received quite as many questions about My Health Record in the last little while as we had done when it was first starting up, and also when it moved to an opt-out thing for patients. So the things that I'm going to cover off this evening briefly are what your general obligations are, talk about a bit about consent. Hopefully you will know all the answers to the questions I'm going to ask because of Jenny's wonderful presentation. I'm going to just run through some liability issues, and then I'll talk about some privacy issues. So the first thing that we're often asked is about what is a doctor's obligation to consult the My Health Record? Well, generally, there is no obligation on health practitioners to be involved. It's opt-out for patients, but it's opt-in for healthcare providers. So as a consequence of that, there's no legislative obligation at all on you either to be involved or to check the My Health Record. A lot of doctors were concerned that once it came in that they'd be obliged to check it. The concern that they had in that regard was really around the fact that certainly it's not intended to be a complete record because not everybody's involved. And doctors were very concerned that if there was an obligation to check it, they might miss something, and that if it wasn't a complete record, how would it be useful at all? I mean, the good thing is, as we've seen from Jenny's presentation, that many more documents have been uploaded on the My Health Record in the last few years, and it is becoming more and more helpful and useful for clinicians, as Troy was mentioning. So there are two really primary obligations that you have in using the My Health Record system as a healthcare provider. The first is the one that I've referred to there, which is is ensuring that any record uploaded to the My Health Record is accurate, up to date, not misleading, and not defamatory. That's a really important obligation. Now, some people might be a bit concerned about that. Seems quite might be considered quite an onerous obligation, but in fact, it's no different from the obligation that you have generally when you're going to be providing records or writing notes or writing reports back to your referring practitioners. You need to make sure what you write is accurate, up to date, not misleading and not defamatory. So it's no different from your general obligations at law. The second primary obligation is around security. You do have an obligation under privacy legislation generally to take reasonable steps to ensure the privacy and security of the information that your practice holds. Under the My Health Record system, you have to ensure the security of your system because it does connect into the My Health Record system, and therefore could be an access point, I suppose, for cyber breaches or hackers or whatever. And we've heard a lot about cyber breaches in the last couple of weeks. So it is very important to ensure that your system is secure. The My Health Record legislation requires you to have a security and access policy, and the Office of the Information Commissioner has recently produced a guidance about that policy, and it outlines, I don't know why my thing's jumping ahead, sorry, and it outlines the requirements that you need to have for privacy and security, your policy, and has a template policy. So it's very important to ensure that if you do sign up for the My Health Record, make sure you have that policy, check out the information. I can provide the links to the PHN so that you can have access to that material. So given that you're not obliged to check the My Health Record at all, when is it a good idea to check it? Well, again, that's a matter for your clinical judgment. I think Troy has given some good information about when he checks it. having a new patient is a good opportunity to check the My Health Record system if a patient doesn't remember what's happening. So it's definitely a situation where you need to use your clinical judgment to determine when it would be useful to check the record. Okie doke, on to consent. Hopefully you will know the answer to that first question from Jenny's presentation. There is a standing consent under the legislation that allows you to view and to upload materials to the My Health Record. So you don't require specific consent each time you view it or each time you upload documents to it. I suppose the caveat that I would put on that is that it might be good practice in the circumstances, particular patient circumstances, to discuss with them what you're going to put up on the My Health Record. Some patients, and we've had doctors who've expressed concern on behalf of some of their patients that there might be sensitive information that's in the information that they're about to upload, that's in their medical record. They are concerned about that sensitive information being provided to other healthcare providers. And sometimes patients may really have not thought about that. And actually, once you've had that conversation with them, they might think actually maybe they don't want to have that put up. I might ask Troy about that later to see whether he's had any instances of that and whether that was just, whether that's really a concern. So certainly it's good practice to explain to your patient what you're going to be putting up on the My Health Record system. If a patient asks you to withhold clinically relevant information, you may have noticed from Jenny's presentation that that's an exception to the issue of consent. So patients are able to withdraw consent for uploading information. And if they say they don't want you to upload a document, then you can't upload it. But what if there's a little piece of information they don't want uploaded? My answer to that question would be your obligation is to ensure that the information you upload is accurate, up to date, not misleading and not defamatory. And by withholding a particular piece of clinical information, that might make that document incorrect, and it may be not clinically useful at all for the person who might be reading it, another healthcare provider who might be reading it. So we would say that's no different from the situation where a patient might say to you, I don't want you to put that in the report back to the GP. I don't want you to make a note of this particular thing that I'm telling you. It's about having a conversation with your patient about the importance of the clinical information and why it's required to be included. But certainly, if you don't think it's correct or accurate to put information up on the My Health Record without the particular clinical information that they've asked you to withhold, then there's no obligation to do that and you shouldn't be doing that. Sometimes doctors have asked us the question about what if they think something shouldn't be uploaded to the My Health Record. Again, a lot of these questions came about when there was a lot of concern about privacy. So I'm not quite sure, again, I'll ask Troy, I'm not quite sure how much this comes up now, but lots of doctors have the view that maybe it's not in the patient's best interest to be putting information up on the My Health Record if all sorts of healthcare providers can look at it, or it's particularly sensitive information. Again, that's a matter of discussing that with the patients. The patients might be quite happy to put it up, and it's their choice to ensure that that information goes up on the My Health Record. So again, it's about having a conversation. In some situations, though, there are some restrictions in the legislation where certain information can't be disclosed to other parties. And so that relates generally to HIV status and that sort of thing. So just be aware of the provisions that apply in Queensland. I apologise, I'm not completely up to date on what the situation is in Queensland, but certainly check that out to see whether that's an issue in Queensland. Okay, privacy and access. Jenny referred to the fact that healthcare providers can access the My Health Record for the purposes of providing healthcare to the patient. There are restrictions on accessing the My Health Record for other purposes. The two key prohibited purposes are for employment purposes and for insurance purposes. So we often get doctors who will contact us and say, I've got to do a employment medical, can I access the My Health Record? Well, no, you can't. That's not for the purpose of providing healthcare. That's for the purpose of providing a report for employment purposes. So those are prohibited purposes. There are some limited purposes, for example, under the under subpoena or court order, where where a third party might be able to access the My Health record. But essentially, it's healthcare providers for the purposes of providing healthcare to the patient, authorised staff, and those staff will be listed in that privacy and security policy that I mentioned to you before, and the patient, and third parties only in limited circumstances. It is an offence to be involved in unauthorised access, punishable by 5 years imprisonment, and also fines of over $300,000 for individuals and over $1 million for corporations. So it's quite serious in terms of the potential implications of accessing the My Health record in an unauthorised manner. So just quickly to run through privacy, I think we've kind of talked about this. You have obligations under the privacy legislation and also under the My Health record legislation to make sure you keep the information secure. Jenny mentioned and on her slides, there was reference to the emergency access provision, and that applies where a patient has limited access to documents from other healthcare providers. There was a few years ago some confusion around this emergency access provision, which is kind of a break glass provision to overcome the access controls a patient or the access controls a patient may have put on the record. A lot of people, when they saw that function, thought that it meant that in the emergency department someone could access the record. And so there were instances, they did an audit, the agency did an audit, and there were instances of people using the emergency access function when the patient hadn't actually put any access controls on it. So they could just access the material anyway. They didn't need to break the glass there. But it's a good function to be able to access the material if you need it, if the patient has put on those access controls. The other thing to mention there is just that there is a data breach reporting obligation under the My Health records legislation. So if there's a situation where there might be something that's compromised the security and integrity of the My Health records system. So I mentioned before about making sure that your system that feeds into the My Health records system is secure. If there's any breach there that might possibly compromise the system, then there's a mandatory reporting obligation to report to the Digital Health Agency and also to the Office of the Information Commissioner. So that was the super quick run through. There's not going to be a test, but there's certainly lots of information available if you've missed that very quick run through. But essentially the key sort of medico-legal things I wanted to point out, it's not a complete record and it doesn't replace a patient's medical record. Whilst I think it's increasingly being used as a bit of a communication tool between practitioners, that's not the only one. So I think given that all healthcare providers are not required to be using the My Health record, I certainly wouldn't be suggesting that you rely on it as a complete record. But it is a really helpful one, as Troy mentioned. Patients control what goes into their My Health record and how it's used. Certainly you need to take cybersecurity seriously. That's a bit trite to say that, but I think the recent events with Optus and Medibank really have highlighted that. You should definitely have a chat to your IT providers to ensure that all of the requirements, cybersecurity requirements and things everything's been updated and you've got good systems in place. You need to have that, you should have a privacy and security policy in your practice, but you also need to have that security and access policy. My thing is just, I don't know why it's moving. There's some gremlin in this room. Perhaps it's trying to wind me up. You need to have that security and access policy, and there's a template available. And also importantly, make sure that you train your staff on how to use the system. So now I can go to the end. That's all I was going to say. Troy, I was going to ask you, do any of those things that I've mentioned to you resonate with you? Have you had any of those issues, or is it all been smooth sailing in your neck of the woods using the My Health record system?
Oh, look, I'd actually say the bulk of it's smooth sailing. I tend to mention to the patients that I'm uploading their letters to My Health record. Partly, patients, there has been a lot of movement of GPs in amongst COVID as well. There's been a lot of burnout. So a lot of patients have had to shift practices. One of the things that happens then is new GP will be asking for their previous letters. Being able to tell the patients, all my letters are there on my health record the last couple of years. So it saves my practice staff a lot of time as well. That also happens from the hospitals. The hospitals often were calling up, a lot of my patients will go into Tweed Hospital. The hospital down there would call up asking for the background letters. My staff now can say back to the hospital, actually just check my health record, all the letters are there. So it's saving a lot of time that way. In terms of the sensitive patients, as Jenny was saying earlier, they do have the ability to put access controls on. So that's really handy because it's not like they don't want healthcare. So if they go into an emergency department and they're not able to give a history, someone then being able to break the glass, as you said earlier, and access their health record when necessary is important, and they can give the access codes to any other health provider that's involved in their care. And HIV is probably the most common one that I come across where they're concerned. But having said that, we're seeing more syphilis around than 15 years ago. We've seen a bit of an outbreak of syphilis coming back through, and that's also something that's got a bit of stigmata attached to it. So I think with those patients, again, I don't say go away from my health record, put on some access codes, and that way you can just release the information to those that you want to be able to access it. And there, as you say, there are very strong penalties against this. I usually just point out that any health professional will be threatening the registration. I must say I've forgotten about the 5 years jail. That's probably even stronger. It shouldn't be a system that anyone's thinking of breaking into for the wrong purposes, but it's very useful from the health provider perspective. The only other thing that rang a bell with me when you're talking is there was a specialist talking about the idea of intellectual property, and he was worried about putting his information up there because he's done these tests and he's come up with these theories, and he doesn't think someone else should be able to take that on and sort of assume the care of the patient and make it easier for them without doing that hard work. I don't subscribe to that myself, but I can understand, I guess, where he's coming from. He was also worried that there'd be an ability to poach patients from that as well. They could see in the emergency department, oh, he's seen that particular specialist, or maybe we could go to this one instead, or they'll grab the information from there and make it easier for them to look really smart. I don't know. I think most doctors, if you're doing your job, you're going to be busy anyway. I don't think you need to be worried about retaining patients in that regard. I'm quite happy to share any information I come up with, and if that enhances the care of the patient, wonderful. And if they move away with most patients, I'm always suggesting that they find a specialist closer to home, and I'm more than happy to pass the information on, and this makes it even easier for that transition. And again, like patients, when they used to move to Sydney, Melbourne, whatever, I'd say, well, depending on where you are, maybe find out where the closest one is that your GP would use. I can send the information through. Now I can just say, look, it's all there, so they can access it any time. So as I say, in general, I just keep on seeing more and more positives out of the system.
Yeah, it was interesting, that comment you made about the intellectual property. There was, when the My Health Record, it used to be called the Personally Controlled Electronic Health Record, and it changed its name to the My Health Record. When it was the Personally Controlled Electronic Health Record, when that change happened, then there were some other legislative changes that happened at the same time. There was also a change to the Copyright Act that said that there's no copyright in essentially no copyright in the documents that you would be uploading. So if there was some concern, because there were various technical provisions that said that if you'd uploaded other people's documents, it would be a breach of copyright. It's not the same question as you've mentioned, which is about intellectual property in some sort of, I don't know, some device or some way in which someone does something, but it has been thought out in terms of copyright. So no one has to be worried about copyright in terms of if they upload documents to the My Health Record that might have been authored by other people. And particularly patients, I guess, if they're putting things on that document, on the My Health Record, I should say.
I think my other point with intellectual property is, at the end of the day, the patient has paid for that assessment, whatever it is, whether it's an investigation, whether it's an opinion. And my take on that would be, it's really their property. They've paid for it. You've been paid for your services. You should be able to provide it to them. So if any patient was asking for a written record, I would think that most doctors should be pretty reasonable about providing that under that circumstance too.
I was just going to write a message too in the chat, but I'll tell everyone, if anyone has any questions, please feel free to type them in the chat, and we can address those. We actually only got one in the pre-lodged questions, which has pretty much been answered a fair bit. What are our obligations to upload to My Health Record? So we've really covered that, I think. And there was another comment, though, that currently Gen 2 and Fido do not have an upload feature. I don't know if you want to take that one, Jenny.
Yeah, I'm not familiar, I must admit, with the Fido product, but I know that Gen 2 does have a specialist letter uploading functionality. So if that is not something that you can see on your end, it might be worth contacting Gen 2 just to make sure you've got the most recent version installed, or you might need to change some settings over to make sure that you can access that functionality. Otherwise, I'm sure you can also reach out to Sharon, who can help look into it and find out, yeah, what might be not kind of working, but definitely just want to highlight if you're someone who's not using My Health Record already and you are interested or you're not sure about your software product, do reach out to Sharon and the PHN and they can support you. We've seen a large number of products that have come onto market offering My Health Record access in the recent sort of years, and there are also other options available that will provide you access. There are things like the National Provider Portal where you can still view patients' records even without having any software. It's a web browser sort of system that you can access. You won't be able to upload anything to a patient's record, but you can still see any summaries they've had uploaded or any test results. So it is still a great tool if your software product for some reason doesn't offer you My Health Record access. But I might throw one more question at Troy, if that's okay. I guess we've also touched on some of those patient controls that people can add and different codes and things that they can use on their record. In your experience, have you noticed many people using those functions, or are you finding you can usually quite easily access most people's records?
So I haven't come across anyone who's had to give me a code yet. I've certainly, as I said before, had a number of people that had different reasons that were barriers to saying yes to My Health Record originally, but the bulk of those are switching it. When I actually show them how we use it and how it's useful for them in all the various situations, including the medications and us reconciling what we think they're taking versus what they're being dispensed, the bulk of them are saying, yeah, no, I'll get that switched on. And usually that's a pretty easy process. The one thing through my system is I realized only today that I've got to re-verify, because they'll come up as red as not having said yes to My Health Record. I had a few people say now they're dribbling back in from 2 or 3 months ago where I was saying, please switch this on. And one fellow was saying, oh no, but I did switch that. And then I realized through my system I've got to re-verify, recheck, and then I'll switch it to green so I can access it. So I've got to get used to that part, just rechecking with the ones who are currently still red. But it's already been useful for those. And the other thing that I'd point out is there's a lot of patients who, probably more than 5 years ago, a lot of the pathologies would actually send them a written copy of their results. And a lot of patients do miss that. Retired doctors are a great example where they're not necessarily through a software still and able to log in and check on their own results. And again, sending them to a pathology provider who automatically uploads to My Health Record, as I say, where I am, QML is automatically doing that on all their patients that have said yes to it. That means that they can just jump straight into My Health Record, peruse their own results, and often that helps guide their questions for the consultation as well. So it's handy that they've been able to do that beforehand, if not after the consultation.
That's really great to hear that you are actually managing to get patients on board as well and getting them signed up and switching on their My Health Record. I think we've definitely seen a bit of kind of an uptake in the recent years with after COVID and everything like that, people want to have easy access to their health information just in case something happens. So I think it is really valuable that they know their information is in there, especially if you are letting them know that you're uploading some information, like a letter to their record. If something was to happen and they were seen by a different doctor after hours or something like that, they might know to kind of alert them to the fact that there might be something in my health record as well. I think it's really, good for them to know it's a resource that's available.
Yeah, a lot of people are doing a lot more travel as COVID has sort of worn off. They're out on the road and going interstate, and a lot of my patients are pushing that with wherever they are going. They run out of scripts or do something, and often we can do that electronically wherever they are. But if they do pop into a doctor or have an acute problem, they're able to say to the provider, "Oh, yeah, but everything's on my health record, so you can access it," and that's saving them a lot of grief.
And I guess when you started using my health record and switched over to kind of, uploading your letters and things to it, have you noticed less admin time spent on, kind of sending that information to other providers? Are you seeing a big kind of benefit in that space from using it?
Well, I should be able to wake up Leanne and she can tell us all about how much time it's saving in our practice. I think you're still there, Leanne?
Yeah. I don't know if you can see me, but
Yes.
can you hear me?
Yes, we can see you and hear you.
Loads, as Troy said, with knowing that the Tweed Hospital, for example, is connected to my health record. We used to get a lot of inquiries from the pre-admissions clinic to send the last consult letters, or we get inquiries from emergency because a patient has arrived. I'm able to just access, have a look, the patient's got a my health record. All of Troy's letters have been uploaded on there and they're able to get instant access. So I'm sort of trying to educate the pre-admissions clinic and the emergency room to use the my health record as well, because it's instant. Sometimes I can't take their call because either Troy's doing telehealth or I'm on another call, or sometimes we can't get to, read the emails for at least 2 or 3 hours. So, educating them that they've got this instant access. They don't need to have to wait for that information. So, I'm going to get onto Audit 4 and see how long it's going to take them to get, the Sullivan and Nicolaides things, because I get a lot of requests from patients who have had their pathology with Sullivan and Nicolaides and they want copies of their pathology. So, obviously if they can access it through my health record, that's going to make it so much easier all round. So it's been good.
Thanks, Leanne.
Okay.
Thank you. All right. Well, I guess if there's no other questions, just checking in with you, Sharon, if there was anything you wanted to say before we wrap up.
Yes, thank you. I just wanted to let everyone know that we will send out the slides, if that's okay with you, Jenny and Georgie. And if you do come up with any questions after the session, feel free. We'll put our contact details here at the PHN if you need any assistance getting connected or using the system better. So that will come out. And we will actually put a little poll up just a question at the end for a bit of evaluation, and then we might yep, I can see it there. If everyone wouldn't mind, just click on that poll and we'll send out another little evaluation in the resources at the end. But I'd really like to thank Jenny, Georgie and Dr. Kay. I think it was a great session and I always love hearing it being used practically, like in real life, because it's been a long time coming, getting everyone used to it. And it's good to see a lot of patients now kind of expecting it and starting to demand it a little bit. So I think we'll get to the point that we'll think, how on earth did we operate, not operate, but function as a healthcare provider, not having all that on at our fingertips and having to make phone calls and things. So it's just a sign of the times. But thank you all for coming. It was really valuable. And I hope everyone enjoyed the session.